Well, as we're getting ready, because I think we're getting a little bit closer, I just want to say hi to everybody. Brandon Ray Ramirez here with Healthy California Now. If you are here for the Governor Lead the Way on Single Payer Rally, you are in the right place. This is where you're supposed to be. You're on the right Zoom. We're working on getting this up on our Facebook as well. So once we get that up, we'll be able to kick off and let everybody join in on the festivities. Um, right now, I guess we can go ahead and just get started a little bit. I'm gonna lower the music. I'm so sorry. So everybody can truly hear me. It was fun while it lasted, wasn't it? Great. So today is going to be really awesome. We have a ton of really exciting speakers, folks who are coming out of the labor movement and working class folks who are either impacted by our terrible private healthcare system, people who've been on the front lines of fighting for single payer in California. So it's going to be a really exciting day because we have a lot of wonderful updates on the movement. If you are new to the movement, welcome. We are very happy to have you here. If you're somebody who has been around the movement for a very long time, thank you for all that you've been doing, everything that you've been doing to help move us forward. And everybody who's in between, thank you for being here, and let's keep on working together. So again, something I want to make sure before we go ahead and move into our video, something I want to make sure that we do say at the beginning is that a lot of us here are calling in from somewhere in California, and if you're calling in from somewhere in California, then you are calling in on Indigenous land. We want to acknowledge that we are all on Indigenous land. I am currently calling in from Los Angeles, so I'm on Tongva, Quiche, and Chumash land. I want to acknowledge that and the Indigenous people who are continuously fighting and are a part of this movement as well. And we want to make sure that we are inclusive of all of our shared struggles. So thank you for coming, and let's please make sure that we do keep all of our shared struggles at the centers of our movement. So I do believe that, just so that if anyone is new to Healthy California Now and some of the work that we've been doing, there's a video that I believe we'll be able to share that's going to give a little bit of background of how we actually got to today. So I don't know if that's something that we're actually able to tee up there, but Jenny, I think if we can go ahead and play that video, that'd be awesome.
Here we go. Here we go. See my screen, right?
Governor Newsom.
California needs single-payer health care.
And we need it now.
Single payer means comprehensive health care,
Including
medical, dental, vision, hearing, mental health, reproductive health, and long-term care.
Está garantizada.
With no copays, fees, deductibles, out-of-network, denial of coverage, or bills.
we needed this before the pandemic.
And it becomes more critical each day.
You have the opportunity to make long-lasting improvements to our healthcare
by persuading the Biden administration to grant a federal waiver
to expand and significantly improve Medicare for all Californians.
我哋記得喺川普上場嘅第一日，你都有咁樣做。
Now you have the support and the urgency
to fulfill your campaign promise.
So there's no reason to wait around on universal health care and single payer in California.
We agree.
And we understand the power of the health insurance and pharmaceutical industries
and the millions they'll spend trying to defeat our efforts.
But we're stronger
together.
Governor Newsom,
we are calling on you
to lead the way for single payer in our state
and our nation.
Californians, please join our fight. Add your name at petition.healthcare.
Thank you for playing that video. It is a huge part of why we are here, how we got here, and some of the work that we've been doing as part of this coalition, really to gather signatures, talk to our friends, our coworkers, our neighbors about how important it is for California to lead the way, how important it is for Governor Newsom to lead the way on single payer. that he really does have the potential to really do this. So we've collected a ridiculous amount of signatures. I'm sure that other folks have the exact number of how many signatures those have been, but we collected a ton of signatures. And tomorrow, June 15th, there's going to be this wonderful action that we're going to be holding. Car caravan in person, and also in Sacramento, there will be a rally that's going to be taking place at the state capitol. It's going to be urging Governor Newsom to lead the way on single payer as we present thousands of petition signatures from Californians to the governor. So this is going to be a wonderful kickoff. It's going to be taking place in person. So we're going to be able to get outside, some of us out of these boxes that we've been stuck in on Zoom, and be able to really tell the governor and others why we're here and why we're in this movement. So before we go in any further, I do want to just acknowledge some other pieces to this movement. It is extremely exciting to know that we are now reaching a point, critical mass, where we're going to be able to lead the country on single payer, that we have this potential. But we also need to understand and set the stage of what's really been taking place and how we've gotten here, right? A lot of us who are in this fight are in the fight either because we ourselves struggle with the private healthcare system. We have loved ones who have been struggling with that, who are fallen victim to that, who many of us have had loved ones, especially, and this has become very clear in the pandemic, who have struggled with the private healthcare system, and some are not with us today. They are here in spirit, but they're not here with us today. We want to keep them with us in our struggle. We want to keep our ancestors with us in this struggle. We also want to make sure that we acknowledge that even though there is a reopening taking place, the pandemic for many people is not over. The pandemic is not necessarily over for those who are frontline workers, those with autoimmune diseases. Many in the global south are still dealing with the ravages of this pandemic. So we want to make sure that we have international solidarity with them. We recognize that this is something that everyone is still struggling with. And so while we do have some glimmers of hope here in California, we do want to acknowledge that not everyone is over with this. And also, just to put some additional context here, and make sure that, we want to make sure that this movement itself is centering those who are most directly impacted by our private healthcare system. And again, what's been shown so clearly by the pandemic, Black and brown workers were impacted far more from the pandemic than other groups. And that's clearly from systemic racism. Want to acknowledge that this Saturday will be Juneteenth, the acknowledgement of the end of slavery, and we're recognizing how this coalition really centered that Black health matters, really centered how the Black Lives Matter movement was something that we stand very closely in solidarity with, and we want to uplift the overall fight for racial justice. Also want to acknowledge that last month was AAPI Awareness Month, and recognizing that we do stand with our Asian brothers and sisters. We stand with the Asian community. We stand against hatred towards Asian Americans. We have some wonderful speakers who are going to be able to speak a little bit more to that. And also acknowledging that this is Pride Month. The LGBTQ community is unfortunately no stranger to the ravages of the private healthcare system, discrimination of the healthcare system. And we want to recognize that we would not be here today without any of these movements that we've acknowledged. This is our shared struggle. This is what has put us in this place, that we have this class consciousness because of those struggles. So I definitely want to make sure that we continuously center these struggles, we continuously honor these struggles, and we keep that as our North Star, because this is a shared struggle for justice. So thank you all for being here. You're all part of a wonderful radical tradition, and we're going to continue this moving forward. And thank you all for being a part of this. Just to quickly go through our agenda and review, we'll be having some wonderful speakers who are going to talk about why we need single payer. They'll be able to share stories from their communities respectively, and we're even going to be hearing from some really wonderful labor leaders you probably saw in the poster. But we do have Dolores Huerta will be able to speak with us as well. That'll be a real treat. And then we'll have some calls to action as well about June 15th, folks who are far more knowledgeable than me, some wonderful organizers who've been working with Healthy California Now, who can speak specifically to the call to action. So I'm gonna stop taking up so much space, right? We'd like to play a clip from Jenny, I think this is another clip that we have that we want to tee up from this really wonderful up and coming leader on single payer. I don't know if you've heard of this person before, but you might as well just go ahead and play the clip because it's really wonderful.
Mr. Newsom, you've said that you support universal health care and see a single payer system as the best way to achieve that. A state-level single-payer system would require the state to cover costs for all Californians, including those who currently receive health coverage from private insurers. How would you propose paying for such a plan?
Well, we're in the process of deliberating that right now through the process known as SB 562. We need to jumpstart that process anew. I think there's a lot of mythology about the cost of single-payer, that somehow we're adding on top of an existing multi-payer system, when in fact it's about reallocating existing resources and using them more effectively and more efficiently by replacing the current multi-payer system. The fact is we're already spending $367.5 billion a year on health care, according to UCLA, in this state, 70% of it borne by the taxpayers. A single-payer system drives down the cost of health care, drives down the cost of prescription drugs through economies of scale, and provides a more effective, efficient, and universal access for those that are uninsured. You still have 3 million people in the state of California without health insurance. And even through Color California, millions of others have seen double-digit increases over the course of the last few years in their premiums. Single payer is the way to go to reduce costs and provide comprehensive access.
Get tired of it.
That guy should run for office. He's, we need more leaders on single payer in office. We just run for governor. That'd be great. So I'm gonna go and flip this over to Maribel Nunez, who's a wonderful organizer with Inland Empire Partnership and does a lot of wonderful work with Healthy California. She'll be able to tell us a little bit more about the June 15th action tomorrow.
Hi, can you all hear me? Can you all hear me?
Yes. We hear you.
Yes. All right. Hi, everybody. Welcome. Thank you for joining us. I know that we had a little bit of a glitch, and welcome to everyone that just joined us. Today we have our big day of sharing, our town hall about Gavin Newsom leading the way to single payer. And so we're very excited at having over 100 or so attendees. So this is awesome. But for tomorrow, day 2, we will be meeting. We'll be doing a caravan to pass to give Governor Newsom over 19,000 petitions from California activists from all over the state. And I did see a lot of folks here that help with that. And I wanted to give a shout out. I did see Eric Bonds. I wanted to give a shout out to Eric for helping with this as well, and everybody here. And yeah, tomorrow we're going to be joining in at 10:30 at the caravan, and we're all meeting at the West Sacramento parking lot. And we need people there to meet up and do the honking and be able to honk the horn for single payer. And then and then we'll be getting together at 11 in the California State Capitol North Steps, the North State Capitol. And so we really are excited about the action tomorrow, delivering those petitions, all the hard work that everybody has done. And yeah, and I think the other thing I want to do is do a shout out for social media and tweet to kind of share your stories and facts. And the hashtag is Gavin Lead the Way. And I know for tomorrow we're going to be using hashtag Keep the Promise, hashtag Gavin Keep Your Promise, right? Just as we heard that the governor had campaigned for single payer, and we're going to keep him to his promise. So I'll pass it back to Brandon, and please tomorrow join us. We will continue doing the action caravan and doing the rally and passing out those petitions. Thank you, Brandon.
Thank you so much for that, Maribel.
Just to jump in, I'm sorry, we're using one hashtag in particular, is Gavin Lead the Way. It's hashtag Gavin Lead the Way. There's other hashtags where, such as DSA pressuring the governor, and that some of those other ones are the ones Maribel mentioned. But for this particular action, it's Gavin Lead the Way.
Lead the way. We shall. If we all pressure. If y'all tweet, make the calls, and show up, and you honk, and keep telling your friends and your family and your neighbors, I think it's going to happen. But A lot that's the how. I want to know the why. Why the governor? Why the waiver? There's a lot of strategy talk. And someone that I bug far too often for strategy talk is our next speaker, Michael Leidy, who is possibly one of the most knowledgeable people about this strategy. So again, y'all in for a treat. Michael, if you'd love to step on up and explain to everyone.
Thank you, Brandon. I really appreciate that, and really appreciate you emceeing this event. I was asked to talk about what is single payer. We're going to have Jody Reed from California Alliance of Retired Americans talk a little bit about why the governor, so we, I think it's important to remember what single payer is. Single payer is a system of financing healthcare where there is one fund that pays for all healthcare services that are medically necessary. And these are comprehensive benefits that everyone needs to live a fulfilling life in order to get the healthcare we need. It's a system that guarantees healthcare to all and eliminates the profits and administrative waste of the current commercial insurance industry, which denies us care, creates barriers to care. So we eliminate those barriers to care. We eliminate the financial barriers to care. We address the racial inequities that exist in the current system created by the marginalization of people of color and low-income folks. And particularly, we address the public health crisis that exists in our country as a result of state-sanctioned violence, chronic diseases, the withdrawal of health services from frontline Black and brown communities. Single-payer financing enables us to do all that because we are able to eliminate the administrative waste and the role of these commercial insurance companies that deny us care and literally kill us. An example of single payer, of course, is Medicare. Medicare is the most highly regarded aspect of our healthcare system. It is not perfect by any means. So when we talk about single payer, we mean an improved Medicare for all. That is a Medicare that expands benefits, that eliminates out-of-pocket expenses. These are the kinds of financial barriers that exist in the current system that prevent us from getting the care that we need. And it also prevents communities from getting the care that we need because those communities may be lower income and they are not considered profitable by the healthcare industry. So guess what? The services get withdrawn. Single payer changes that. We fund healthcare based upon patient need and community need. And we empower providers so that clinical judgment of our healthcare professionals determines the care that we get, not some bureaucrat in insurance industry office, not some CEO who wants to deny us care, not an HMO that decides, hey, we're going to skimp a little bit here in order to save money so that we can use our net income to expand nationally. Instead, patient care is the focus, and that's what the money is spent on. So when we talk about single payer, we're talking about a system of guaranteed healthcare for all, regardless of immigration status, that provides healthcare facilities based on community need, that controls costs through global budgets so that the facilities have enough money to care for their patient population, but not money for profits, high executive salaries, and administrative waste. Instead of the fragmented multi-payer system that we have now, we're able to control costs because there's one payer. And that's what we mean by single payer, a fund that pays for all healthcare services, that eliminates barriers to care and guarantees care to all with a single standard of quality care. And that's what we expect Governor Newsom to lead on. And regardless of how we want to go about organizing and winning single payer, executive leadership, the governor's leadership is crucial to that. It's crucial to moving legislation. It's crucial to engaging the Biden administration. And so when we talk about and we say Gavin lead the way, we mean it because we have a history in this state of getting very close to enacting single payer. We've seen it under Governor Schwarzenegger. We saw it move under Governor Brown. But what a coincidence. Neither of those governors supported single payer and it didn't happen. This time it's got to change. This time Gavin needs to lead the way. This time the governor's got to keep his promise. Thank you, Brandon.
Thank you. Thank you, Michael. And okay, I was getting a little ahead of myself. I'm not gonna lie. I was thinking, I was like, all right, we got the how, we're talking about the why. I got a little ahead of myself. Still, our next speaker's thunder just slightly, but she's too thunderous. Next person we're gonna have speak, thank you, Michael, is Jody Reed from the California Alliance of Retired Americans, to tell us now why the governor, why the waiver, what's the strategy behind that, and why it works.
Thank you, Brandon. And we just hit 200 people on this Zoom. Yay! And it's growing every minute. It just shows the level of interest and support in finally winning a single payer system in California and leading the way for the rest of the country. So why the governor? Well, as Michael just said, we have for decades, it seems, experienced what happens when we don't have a governor on board. And the best bills, the best efforts in the legislature can only get us so far. And if the governor isn't going to help move this forward, then all of our efforts land on his desk or her desk, and we go nowhere. So that's why our theme and our focus for today and tomorrow is to ask the governor to lead the way. And the first step in leading the way is to start the process of requesting a federal waiver from the Biden administration to begin the process of determining how to release the federal funds that are necessary in order to finance a single payer system in California. This is something the governor did when the Trump administration, when he was first elected and Trump was the president, and knowing good and well that that request was probably going to wind up in the big garbage bin. But now it's time to make the same request of the Biden administration, and in particular, the Secretary of Health and Human Services, Javier Becerra, someone who is very familiar with California, and when in Congress, a big supporter of single payer. So not only do we have the personnel in place to help us make this request and help us develop the process for honoring that request, but we also have the authority to do so. The authority comes in a couple of ways. One is the Affordable Care Act itself, which Biden is probably the biggest, strongest, loudest cheerleader for, as it was passed, and he was the water carrier in many ways for President Obama when it was introduced. It does give the authority for states to seek a waiver to improve upon the benefits that are currently in the Affordable Act and to allow states to go beyond. So there is clear authority already within the Affordable Care Act to give California and any other state that wants to move beyond and provide more comprehensive benefits, better financing structures, save money. But in addition, Congressman Ro Khanna, many of you have probably heard, is just introduced a state waiver bill that clarifies that waiver process even more. So not only do we have the authority to do it right now, but Congressman Ro Khanna is going to make it even easier while we're engaged in this process. And yes, we also need to have legislation or an initiative or the plan in which this waiver the money from the feds will then be part of the financing package, but we cannot move forward without that waiver. And so it is not an either or, it's a both. And they both need to happen, and there is nothing stopping us from starting that process at the federal level. But even more importantly, as you heard in the governor's debate that we saw the video on just minutes ago, this was a promise that he made to California when he ran. And in fact, it is what separated him from his Democratic opponents, some of whom were not in support of single payer. And it is part of the reason why he won the election as governor. This was the promise he made to California. And furthermore, now that he's in another fight to keep his seat, it's become very clear through polls and focus groups that the issue, especially as we're still in this pandemic and reeling from the economic and racial disparities that have only become much clearer during this pandemic, the people who lost their jobs and lost their health care during this pandemic, the many older folks who died in nursing homes because they couldn't stay at home with the care that they needed during this pandemic. The case is even clearer than it ever was, that we need to move forward in California. And the time is now, and the public is with the governor. Polls show that voters want the governor to take bold action to improve our broken healthcare system. And if this governor wants to win the recall by a landslide, he needs to lead on those issues that the public is expecting him to lead on and that he promised to lead on. So the next step is to say, Governor, okay, lead. Take the next step, start the waiver process, help us get the Healthy California Commission to develop a very clear financing plan, and let's plug that into legislation or an initiative or however we move forward so that we can make this happen in the next year, because we cannot afford, both from a financial perspective or from a human perspective, to wait another minute. And so the governor is the key to us taking the next step. If he doesn't want this, he's going to tell the legislative leadership in California, don't bring this to me. I don't want to move this forward. We have to show him we've got his back. You lead, we'll follow, we'll be the wind behind your sails, but you have got to take the next step. And there are several things he can do. And the first is to start the waiver process. Thanks.
Thank you so much for that, Jody. I don't know if y'all saw, I was taking notes on the side. We were making some good points there. And I have a feeling Gavin's ears are ringing. He's hearing a lot today. So he's hearing us. I think he might already know about the Zoom. So hopefully the message is coming across. So next up, we want to hear we have some really wonderful speakers in this next batch here. Hearing from stories from the community of really the impact of our private healthcare system, why we really need single payer. So we really want to hear from a lot of folks who are on the front lines, people who are impacted by the system. The first of which is we're going to be hearing from Alan Galeon from the Filipino Workers Center. I believe Alan cannot see your Zoom box, but are you here?
I'm here.
There we go.
Yes. So cute. Thank you, Brandon. To every person called to be in this space tonight, my warmest greetings on behalf of myself, every member of my family, especially my 5-year-old son and my 80-year-old mother, my dear organization who ushers us to fight for our rights as domestic workers, the Filipino Workers Center of Southern California, and most especially on behalf of my brother and sister farm workers from the Central Valley, Orosi, Cutler, Dinuba, Visalia, and Delano specifically. My name is Alan Gallion, a father, a caregiver by profession, a worker leader, a community organizer in the city of Los Angeles, and an outreach worker to the Central Valley here in California. I burned my midnight oil to share on this important day, a way forward to brighten the spotlight on what can be perceived as one major action towards equality, the provision of a universal health coverage for all Californians, regardless of their race, gender, sexual orientation, and immigration status. That way forward is one derived from losing oneself in the service of others. As an active caregiver to the disabled and aging communities, and an active community organizer, I plead with everyone the importance of mobilizing ourselves assertively to push for this historical healthcare reform in California, the single-payer healthcare system. Exposed to the daily realities and obstacles my own elderly clients and my parent painfully experience in navigating a complicated network of multiple payers within their current health coverages, I couldn't avoid the thought of romancing the idea of, number one, eradicating skyrocketed healthcare administrative costs. Number two, the idea of regulating price control in coverages. Three, increased life expectancy. Four, improved health outcomes. And five, erase inequities by simply overcoming political barriers, campaigning for the single-payer advocacy. As a Filipino-American frontliner during this entire pandemic page, I wish to emphatically demand that care should be culturally competent. Cultural disparities we all should understand deeper, so collectively we become competent care providers and providees. I now wish to advance this plea to the Honorable Governor of the State of California, Governor Gavin Newsom. Dear Governor, on behalf of the marginalized California domestic workers, and with permission, on behalf of the Filipinx and Latinx farm workers of Tulare County, I ask that you lead the way in endorsing a bill that will guarantee health care for all Californians, so we may be provided a comprehensive universal single-payer health care coverage and a healthcare cost control system. My continued support to your leadership, and please send best regards to our state's First Lady Jennifer and to your children. Maraming salamat po. Tagalog translation to thank you very much.
Thank you very much. That was wonderful. That was beautiful. And thank you for your organizing that you've been doing and your commitment to the movement. We're very thankful for you. Next speaker we have is from the Healthcare for All and Senior Caucus of the California Democratic Party, Ruth Carter.
Thank you, Brandon. And thank you all for being here. We've all seen the tragic COVID-19 pandemic. And at the beginning of this year, we noticed that the inherent failings of our current healthcare system. So therefore, in January, several California Democratic Central Committees from Southern, Central, and Northern counties passed resolutions asking Governor Newsom to fulfill his campaign promise to support single-payer legislation and request the waivers necessary under the Affordable Care Act so we could implement a state-based system. Each Central Committee submitted the resolutions for consideration for the delegates to vote upon at the California Democratic Party Convention in May. The CDP Resolutions Committee chose our resolution as one of the top 10 to be voted on at the general session, and was then voted on by the entire delegate body and adopted with unanimous consent and was sent to the governor. Additionally, the Legislation Committee voted at the same convention to give full-throated support for AB 1400. That also was passed by the delegates, and that information was sent to the governor. As chair of the Senior Caucus, with a membership that contains almost all Medicare recipients, we hear about the many, many, many unmet needs for Medicare recipients. And I want to read you some statistics, just so you can get a sense of it. Federal data shows that about 1 in 5 older adults have untreated tooth decay, and another 1 in 5 have complete tooth loss. Medicare does not cover dental. nor do many insurance policies. About 4 in 10 of Medicare beneficiaries reported having trouble seeing even with their glasses. And only 58% of them reported having had an eye exam in the previous 12 months. Medicare does not cover eyeglass exams or glasses. 2/3 of Americans 70 and older have hearing loss. And at least 75% of Medicare beneficiaries who need a hearing aid do not have one. Medicare does not cover this, nor does Medicare cover long-term care. That's why we're asking for expanded and improved Medicare for all, guaranteed universal health care. Study after study has shown that a single payer system saves money and is the best approach to saving lives. And remember, dental, vision, hearing, and long-term care would be covered with California single payer legislation. So Governor Newsom, as a representative for our California Democratic seniors and Democrats across this great state, please remember we helped get you elected. We're calling on you to fulfill your campaign promise. Request the waivers, support single payer. Our health and our lives depend on it. Lead the way for all of us. Thank you.
Thank you so much for that, Ruth. And yes, we know there's been a growing movement within the California Democratic Party to really be pushing Gavin Newsom, the governor, on single payer, and really the party should really be there. It sounds like there's a growing movement, and thank you so much for your work, Ruth, in helping lead us. Next speaker we've got, I'm not gonna lie, one of my favorite humans that I've gotten a chance to work with. Can't wait to see you in person, bud. A social worker at Kaiser Permanente and is a member of the National Union of Healthcare Workers. Good friend Eric Pierce.
Thank you, and it's good to be here with everyone. I'd like to start out quickly by wishing everyone a happy Pride. Let's not forget that Pride was born out of a violent struggle against police oppression and brutality and state oppression. This struggle continues, and it is deeply embedded in our current struggle for healthcare and all struggles of the oppressed. In this short time, I hope to bring my voice and the voice of my patients into why Medicare for All is needed, necessary, and must be done by the governor. During this pandemic, many of my patients lost their employer-based healthcare insurance. Now, my patients are all HIV positive. That means without their regular medications, they will die. They will get AIDS and they will die. They lost their employer-based coverage. They have no means for treatment. What does that mean to these people? So there are some state programs, but guess what? These state programs have income limits. So if you make $1 over the income limit, the state says you're on your own. Next, let me talk a little bit about my personal struggle. So in 1988, at the age of 23, I was diagnosed HIV positive, a death sentence at the time. Hey, I'm still here and I'm happy to be here. But let me tell you one thing. Every 3 months, I pay $225 in copays for my medication. And I have good insurance. To my union brothers and sisters who think that they need to hold on to these Cadillac plans and not support Medicare for all, I say, listen to you. I say, listen to me. I have one of those Cadillac plans and I pay over $1,000 in copays every year. The time is now for all workers, for all people of the state of California to have healthcare justice, a single payer program. Mental health was deeply affected during this pandemic. As we all may know, the rates of suicide, the rates of overdose, the rates of depression and anxiety skyrocketed. Well, the access to mental health is limited by your insurance. They get to call the number of visits you get to have. To the insurance company, to your healthcare provider, You are nothing but a series of numbers and letters on a plastic card. They know not your struggle, your pain, your misery. Today, we have the ability to push Governor Gavin Newsom to make the right choice, to lead the way in making Medicare for all. I call out to you, Governor Newsom. How do you want history to remember you? As a governor who dined at a fancy restaurant while others were dying and losing their health care, surrounded by wealthy and the well-connected? Or do you want to be known as the governor who led the country for healthcare justice, for people like me and all the other men and women of this state to have final healthcare justice and lead the nation in a just healthcare system? I thank you all. All power to the workers, all power to our struggle, all power to us all. Thank you.
Solidarity with that, my friend. Thank you so much, Eric. And thank you for, again, your commitment to the movement, your commitment to the struggle, and everything that you do day in and day out, as a social worker especially. Thank you. I want to go next to California Alliance for Retired Americans. We have a call on the Democratic Party, and call on the Democratic Party she does. We want to hear from Henny Kelly to talk a little bit about her call on the Democratic Party she has. Oh, you're muted, my dear.
There I am. Hi, my name is Henny Kelly, and I am the Legislative Director of the California Alliance for Retired Americans. I need to tell you, I am part of the Democratic Party, and I have been for the last 4 years chair of the Disabilities Caucus. And many of our people in the Disabilities Caucus are members of CARA too. We are California's largest grassroots senior advocacy program, representing 1.3 million seniors and growing. And we're here today in support of single-payer healthcare. We want the governor to lead the way, and we want him to lead the way for seniors. We comprise 20% of California's total population, but we're expected to account for more than 28% by 2030. Seniors account for more than 48% of all the prescriptions written in California each year. Medicare is covering less and less each year, while we pay more and more for supplemental insurance, premiums, co-payments, and for uncovered procedures and medications. And the number of uninsured Californians continues to grow every year. Working families, especially older workers between the ages of 50 and 64, have no coverage. The pandemic has only exacerbated the problem, with millions of more losing their jobs, thus losing their insurance, or they're unable to pay for the premiums, deductibles, and out-of-pocket costs. Uninsured often forego regular checkups and preventive care and only go to the doctor when there is a real problem, usually to the emergency room, which is much more expensive. Our healthcare system is unraveling. And for those of us on Medicare, which has been the best universal healthcare system in the world, we have been feeling the strain. Medicare was designed to be universal, single payer system. We all get a Medicare card, choose our providers, and the bills go to one administrative entity, one payer. And Medicare does all this at an overhead of less than 2%. Unlike private insurance companies, which have an overhead of 15 to 30%. Yes, Medicare is feeling the strain as it becomes more and more privatized. And as you heard before, it does not cover very important things like teeth, like eyes, like feet. Yet Medicare is still what we want, and we want something like this. We need to get a guaranteed health care for all solution without private insurance companies. The solution is simple. Governor Gavin Newsom pledged that he would be the governor that brings health care to all Californians. He created the Healthy California Commission to start the process of moving the state toward a single unified payment system. They have to complete the task. And the governor must lead us on to winning a waiver from the federal government that will bring funds into our California system. The governor, Governor Newsom must lead the way, and we will stand behind him, and we will lead the way with him. Thank you very much. Please, please believe in this, work for this, fight for this. We can do it together. Thank you.
Thank you so much, Haney. And yes, please, 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 we need everyone's participation in this movement. Reminder, if you are hashtagging, we're doing hashtag Gavin Lead the Way. If you want, again, to learn a little bit more about the Car Caravan in-person rally, go to healthyca.org and you'll be able to find more information, not just about the rally, but you'll be able to find more information about how to get involved in this movement, more resources, more information, things that you can share with your friends, your family, your neighbors, and ways to get connected in the larger movement. So thank you so much. Thank you so much, Haney. All right, next, we're going to hear from the LGBT Center. I want to hear from Dragan Vagic. I'm not sure if Dragan is available, but if you are.
Yes, available.
There we go.
Yes. So my name is Dragana. I'm Dr. Vagic, and I'm an internal medicine physician who works at the Los Angeles LGBT Center. I'm very happy to talk to you today about my experience working as a doctor in Canada and at the US, and why I think we need Medicare for all. There are no two classes of citizen in Canada when it comes to healthcare, like there are here in the United States. While working in a hospital in Canada, I was never pressured to discharge a patient from the hospital early due to insurance coverage. I had more time to discuss the plan of care with my patients, and I had excellent ongoing collaboration with my colleagues. We did not have patients who had gone without care for years or decades, or developed advanced physical or mental problems due to lack of access to care. They all had an anchor. They had their own physician they could see regularly, and they knew for years. This is one of the reasons the cost of care in Canada is less. Many problems are prevented and treated on time. This kind of system removes this cruel anxiety so prevalent in the United States. If patients will be able to get health care, will they afford proper treatment, or will they lose their home or life savings if the bill is too high? A single-payer healthcare system allows people to have more trust in healthcare, which leads to continuity of care, which is really the most important in quality of care. There are no erratic changes of clinics or physicians due to changes in insurance, excessive time spent on clarifying insurance coverage, anxiety about losing one's job and therefore one's healthcare access, or staying in an abusive employment environment simply to keep one's health insurance. This is a daily reality for people in the US, especially if you're an immigrant, the last one, staying in abusive employment environment simply to keep one's health insurance. The current system in the United States promotes fragmented, time-constricted visits, and the majority of time is spent not with patient care, but with substandard electronic health records and insurances. Corporate hospitals are swallowing good quality independent practices, while impersonal, mechanical, assembly line medicine is becoming the standard. There's an army of administrators complicating care and preventing direct contact between physicians and patients. The system is broken and has made physicians lose their voice. If I worked in a different system, I wouldn't have a patient admitted to ICU for diabetic ketoacidosis for more than 1 month because she couldn't get a diagnosis and insulin on time, or a patient in her 30s with inflammatory bowel disease who ended up with a septic shock on a ventilator, intubated with a permanent lung damage and an oxygen 24/7, only because she couldn't get a colonoscopy on time. During the COVID-19 pandemic, we have clearly seen the inequality of access to care and the inequality in health outcomes. This inequality is related to systemic discrimination, racism, marginalization of minority, and most of all, wealth inequality. There is a long history of inequality when it comes to the LGBTQ community and their access to culturally competent care. I'm lucky to work in a clinic that truly makes a difference, but too many Californians and people in the LGBT community are not so fortunate. What we need is improved Medicare for all, not Medi-Cal for all, autonomy for physicians and nurses, direct contact with patients, and equal quality care for all patients. So Governor Newsom, can you lead the way for Medicare for all? Let's make healthcare civilized and excellent for all in California. Thank you so much.
Thank you so much for that, Dragana. We really appreciate you. Next up, we have a couple more speakers and we're going to do a call to action. Next, I'd love to hear from Ada Briceño over with Unite Here to speak a little bit about her experience.
Thank you so much, Brandon. My name is Ada Briceño. I am co-president of Unite Here Local 11. Our union represents 32,000 hospitality workers across Southern California and also Arizona. And let me tell you a little bit about our workers, but they are the room attendants, the dishwashers, cooks who serve our hotels, our stadiums and airports across our hospitality and tourism industry. And I'm proud to represent women and men who every day stand up and take on multi-million-dollar corporations for their rights, just like every single one of you are standing up, because we all believe that healthcare is a human right. So thank you, and I'm proud to stand with you. Let me tell you, when the pandemic hit, automatically 90% of our members suddenly were without a job. And what came with that was the fear of losing their health care. And in the height of the deadly pandemic, the last thing you want to think about is losing your health care. And we know, everybody on this call knows, right, that healthcare should not ever be tied to a job. We see this especially in this moment. We had to fight one-on-one, our 146 individual employers, to make sure that our workers and their families' healthcare continued. And every month, people were worried. And while we were fortunate that many of our workers stayed insured, many of them, as you heard Eric say, also went without. You know, I started in our union negotiating for health benefits back in 1991. And as a negotiator, I saw firsthand how our healthcare system is harming our labor movement. And I'll explain why in a minute. But 95% of our labor disputes are out of the healthcare because of the increased cost of healthcare time and time again. I've been arrested 6 times around labor actions. In fact, one of them was with our dear Dolores Huerta. And every single one of those times was for healthcare. It was healthcare related. We've spent countless of hours at the bargaining table just to protect the benefits that we already have. Because as you know, it's criminal what these healthcare companies are doing with the rise of healthcare. But we know that there's one clear way Governor Newsom can help keep workers healthy while building our labor movement. Single-payer healthcare would free up our unions to organize workers and in turn build the Democratic Party. We could organize for childcare benefits, for fair wages, for retirement benefits, and ending discrimination of all kinds in the workplace. It's clear that our health insurance system is broken, and I'm going to say that as a broken record. Healthcare, if healthcare were treated as a basic human right that it is, workers would not be left out in the cold. when their health is most at risk. And unions could get back to the fight that we all need for working people to build the middle class. Governor Newsom, we urge you to stand with California families. Let's move forward with single-payer healthcare for all Californians. Thank you for all you do towards this fight.
Thank you. Thank you so much, Ada. And yes, we know that through this pandemic, it has been so obvious that it was workers who helped us get through this pandemic. It was workers who dealt the brunt of this pandemic. And if we were able to have a single payer system, some of that I think would have been reduced. But thank you so much for your work that you're doing with Unite Here and all the organizing work that you're doing with frontline workers. You know, one of the things I just want to get out there is we really need to get loud. So tomorrow, join us at the Sacramento Capitol at 11 or the car caravan. And if you cannot be there in person, then please help get the word out about the governor. Remember, the hashtag is Gavin Lead the Way. You can find those details at healthycalifornia.org and find a way to get involved. There's a Get Involved page, and that's where it's going to be. Also, again, tons of resources on healthyca.org. The coalition has tons of resources. I think before we go ahead, I want to just check back and see if we don't have, is Jessica Lehman available? We'll do a check.
Yeah.
All right. So Jessica is not available, but again, we're still going to get loud. We're still gonna keep that vibe going. And I think, you know, thank you again to all the speakers that we've already had so far. Thank you so much for sharing your insight, for sharing the passion, what has brought you to this movement, why you were in this movement, the people that you know that you work with who are impacted, and who we know that their lives will materially be improved if we had single payer healthcare in California, and the impact that would have on the rest of the country. So I want to now tee it up to someone who I think we are all very excited to hear from, someone who has been monumental, who has dedicated her life to the labor movement, to social justice movements, to really helping shape the way that the labor movement and the movement for democracy in California really has grown. And we know has been truly just a staple and a true leader in every sense of the word that we are so happy to have in our presence, so happy to have as part of our movement. From the Dolores Huerta Foundation, without further ado, Dolores Huerta.
Thank you very much. Thank you very much. I'm so happy to join everybody here and to lend my voice to the voices of others. You know, I have many members of my family that are in the healthcare field. My oldest son, Fidel, is a doctor. My daughter, Angela, is an oncology nurse, and my granddaughter is a nurse also. And the thing is that everybody knows them. By the way, some of them are also accountants in the healthcare field. And they all agree that, yes, we have to have single payer because there is no reason why we should be having to pay insurance companies. It takes a big chunk of the money that if they didn't, then we know that we could expand the healthcare and give it to the people that do not have healthcare right now. And it is really a shame that the richest country in the world, the United States of America, does not have healthcare for everyone. But we know that there are countries in Europe that have this. We know that there are countries in Latin America. We know that little teeny Cuba that has an economic boycott on it, that in teeny little Cuba, they have healthcare for everybody. Not only does every person in Cuba have free healthcare, but every person also has a free college education. So there are no longer any excuses why we in California should not lead the way so that the whole of the United States can get our message and say, we have to have healthcare for all. You know, it's interesting because in the year 2000, I had an aneurysm and I was disabled for 7 months. I had to be fed with a tube into my stomach, okay? My medical bill was almost $500,000. Now, there is no way in the world that I could have paid that. But since I'm 91 years old, and I think I was 80 when I had that, guess what? Medicare paid for my bill. Medicare paid for my bill. If I had not had Medicare, there's probably no way that would have been covered. And we know that as we come out of the pandemic, everybody is saying we have to reimagine society. Well, we have to reimagine healthcare. We have to get rid of all of the discriminations that exist in our society, including the discriminations that exist in our healthcare system, so that people that are very wealthy can have wonderful health plans, though some of the very poor cannot. And then we have, of course, all of our undocumented people. By the way, today we delivered thousands of postcards to Governor Newsom saying we need to have health care for all, including our undocumented population. So I just want to lend my voice with all of yours to say, yes, we've got to keep working. And yes, we've got to call on Governor Newsom and say, Governor, we know you are a compassionate governor. But in addition to that compassion, we need you to be a courageous governor. And everybody in the United States looks at you, Governor Newsom, as a leader. We know you are our leader, and we want you to use your voice and your power, your authority, and yes, take the stand and say, it's time. Ya basta, ya es tiempo. We have to have healthcare for everyone. We have to have single payer healthcare for everyone, because we know that way it can be affordable. We can make it happen, but it's going to take a lot of will, a lot of will. Everything that you can do, everything that you can muster, as you have been doing during this terrible time of the pandemic of COVID-19. Now it is time for you to show really what you can do. Governor Newsom, we're all calling on you. You're hearing the voices of everyone here, everyone in the state of California. Yes, single payer healthcare is what we need. Si se puede. Muchas gracias. Thank you, everyone that has lent your voices and all of your work that you've been doing, many of you for so many years. And again, I think this is the time that we can access it, that we need it. Thank you so much. Thank you for inviting me to join your voices. Thank you.
Thank you so much. And that is, it is just incredible to be sharing the space with you, Ms. Dolores Huerta. We actually have heard that there's a few folks who have some questions for you, if it's all right. And we want to take some time. I think Angela is someone who has a question. So I don't know if that's okay, if you're okay with answering just a couple questions from some folks. And I believe it's an Angela out there.
Yep. Thank you, Brandon. And thank you, Dolores. Can you hear me okay?
Yes, I can.
So my name is Angela Hart. I'm a reporter with Kaiser Health News. I've been covering the governor's health policy pitch on single payer since he first made it. And I guess I have a two-part question for you, which is I'm a little bit surprised to see you on a single payer healthcare, advocacy call. So why do you think that single payer is the right time now this year? If you could just be specific on that, that would be really helpful. And then I wonder if you think that the governor has not fulfilled his promise on this. Do you see it as a promise, and has he not fulfilled it?
I think the question was, do I think that the governor is with us on this issue? Or maybe I misunderstood the question. Could somebody repeat that question for me?
I think it was whether or not you think this is a broken promise by the governor, and also why you think now is the time for this specifically.
I think the governor probably agrees with all of us here that this is a good idea. I think he might be, and I can't speak for the governor, of course, I think that the one thing that we do have to convince the governor that he has to follow the will of the people, and that we, the people here, are demanding of him that he keep his word, and that we do get the single payer healthcare that everybody has been asking him to do. And we know that this is not just this governor, it's been previous governors, and when he came and he ran for governor, when he accepted the office here of the governorship here in California, he said that he was going to make changes. He made a lot of promises, And we know often the politicians do make promises. I know he has kept some of his promises, but this is the big one. This is, you know, with all of our meetings that we do grassroots organizing, we do house meetings, and in every single meeting, we always ask people, what is your priority for your family? Number one is always healthcare. That is the number one priority. Second, education. Of course, with our Latino families, third is immigration. But healthcare is always their number one concern, because we know when someone gets sick in the family, it doesn't affect just the person that's sick, that's ill, but it affects the entire family. And it affects their budget. It affects their revenues. So we know that this is so important. And this is, of course, the heart of what we are asking right now for the governor to do. So I think we just have to keep reminding him, and as we did today in Sacramento, presented him with, like I said, thousands of postcards and boxes saying to him, we have to have healthcare for all. So we just have to keep on doing the work and make him understand that we are with him, number one, but we expect him to be with us also.
Thank you so much for that. And thank you for your question, Angela. Is there, I'm unable to see, so if there's anybody else who I was supposed to go to, please let me know.
No, if there's other folks, we have time for a couple questions of all of the speakers. If other folks had questions, you can raise your hand.
Let me see if I can see some other folks here.
I see a hand, Tim Wong.
Yes.
Tim Wong, you can go ahead and ask your question. Just unmute yourself.
I guess I'm wondering if the route is through the governor, since he's taking donations from Blue Shield. How are we going to counteract that? If all the politicians are taking money from the insurance companies to get elected, why would they ever do anything that we want to be done? I mean, how would they ever side with us on this issue? It's a general question, not for anybody particularly, but that's all.
Well, we know that at the end of the day, it's the votes that count, and votes can counter the money. And we know that we've had some hard times because of the pandemic, and some of us were kind of limited in what we could do in terms of our canvassing and getting information out. We know our governor is facing a recall election right now. He's going to depend on our votes, and money cannot save him from people that are trying to get rid of him, okay? So I think this is a way that we counter the money. We just have to remind the governor that he needs our votes and we need his authority to pass single payer. And that's a partnership. That's an exchange that we have. We vote for the governor and he gives us single payer healthcare. I think we just make it, just make it very, very clear that this is what we're expecting him to do.
Next hand up is Randy Hicks.
Okay, so then my question is, the Healthy California Commission is going on. How do we get the governor to get the Healthy California Commission to work on the financing of single payer healthcare? Because if he wants to lead the way on single payer healthcare, he's already got a commission already in place. How do we, the questions for anybody who's out there, how do we get him to get the commission to do single payer financing, and so say how we can pay for it?
With the campaign to prevent Republicans from repealing.
I'll take a stab at that and other people can jump in, but this is Jody from CARA. I think that at their last meeting in June, we saw the beginning of the conversation around financing and single payer healthcare, and the consultant that the commission worked with clearly showed that single payer is the most cost-effective method to bring everybody healthcare and actually save the state money. So I think part of what we've been doing and asking everybody on this call and beyond to do is to stay on top of that commission. We have to, just like we have to make the governor be the leader on this issue, we also have to impact the commission and try and move them towards what is the obvious answer to create a unified financing system. And we started that process for the first time at their last meeting, and we cannot let up. So we're going to have to move and force the commission, just as we have to move and force the governor. So this is not a one and done. This is an ongoing process, and we all have a role to play in it.
Next hand up, being that this is the order, is Sam Frankel.
Hi, can you hear me? Can people hear me okay?
Yes, we hear you.
Okay. I think we're the choir. And so we get a lot of it and the importance of this and the importance of the waiver, which will continue the federal money that helps pay for healthcare in California. My question is, why is it that we seem to not be talking about folding the workers' comp system into this whole thing? There's a tremendous amount of money that employers spend on workers' comp, and rather than having it be a completely separate system, that money could be used to pay for part of this system. I was a roofer at one time. I got hurt on the job. I had a completely different system I had to go through, rather than just go to my doctor and be made better and be retrained, since I couldn't go back to roofing. And so I think we're missing a whole pot of money that would help pay for this. And I'm just curious why we're not doing that.
I'll take a stab at that, Brandon. I've definitely worked on these issues about workers' comp integration into single payer systems, both at the federal and state level. And I think that the intent very much, Sam, is to include it. I think it's a question of making sure, one, that we take over the medical component of workers' comp, but that we also preserve the liability function for employers, so we don't let them off the hook when they injure workers. And that negotiation is not entirely straightforward, and obviously not just a question of how we finance healthcare. So I know that AB 1400 intends, for example, to include workers' comp, just as SB 562 did, but that it is not something that necessarily would be done in the first year or two of implementation. But it would be ultimately the medical portion would be taken over, and a way to make sure that loyal employers remain liable for the injuries they cause. And I think, and it would go a long way to, I think, both making sure that injured workers get the care they need, and also, as you say, lower costs and provide a real benefit to workers. So I think the answer is yes, but it may take longer than just the initial phase of implementation.
We have 5 hands up. We'll try to get through these. We want to end at a respectful time. Next, we have Ron Birnbaum's hand up.
Yes. Can you hear me okay? Can you hear me?
Yeah, we can hear you, Ron.
Yeah, great. No, I'm on a train on the way up to Sacramento from LA, if you're wondering where I'm coming from. And so we'll see people there tomorrow. But one question I want to ask is, why is the message not just Gavin lead the way, but why isn't it also Gavin lead the way on AB 1400? So why are we not emphasizing that when there is a bill in front of the legislature right now? I know it's been mentioned by a couple speakers, but that's my question.
Doug, this is a Michael or Jody question.
Well, I'll jump in, Jody. I think that the truth is that the governor initiating waiver discussions or engagement with the federal government, with the Biden administration, with Health and Human Services Agency, is to the benefit of however we approach this. There's no downside, for example, to AB 1400's movement if the governor is leading the way and generating dialogue and a plan with the federal government. There's literally no downside to it. It's generally the case with the governor that if a bill doesn't move through the legislature, the governor doesn't see any reason to take a position on it. And so at this point, it looks like the waiver strategy and initiating those conversations with the federal government is a way that could benefit the entire effort to move single payer through the legislature with the federal government and under the governor's leadership. So I don't think it's really, as Jody said, an either or. And in fact, ultimately this issue may be decided on the ballot, and the governor is going to have to play a role there too. So we just don't feel that there's any reason to not pursue, particularly since AB 1400 won't be up for reconsideration until January, February. There's no reason now to not maximize the pressure on the governor, because he's someone who can take action tomorrow, and we hope that he does. And that, I think, ultimately would be to the benefit of AB 1400, and obviously would move the issue forward.
And I just want to add to that, Michael is right on, and I want to just add to that we can pat our head and rub our stomach at the same time. There's multiple things that we have to do to move single payer forward. We have to have a waiver. There's no way to move forward without that money. We have to have a plan. The plan is what's incorporated in AB 1400. We have to have, legislative buy-in. We have to transition. We have to have a plan to transition. We have to have a lot more workers, because we're going to have a lot more people have access to care. There are many, many parts of this puzzle that have to be addressed. And the waiver strategy, by getting that started, because that's not a one and done. It's not like the governor can send a letter tomorrow and then there we go. We've requested the waiver and we're done with it. It's a process. It requires the state of California to submit our plans, to submit how are we going to transition? How are we going to make this happen? How are we going to bring everybody in? So we want to start the conversation, and we need that request to start the conversation, but that's not the end of the conversation. That's the beginning of the process. And so we can do many things at once, but we have to get started. And since we are stalled for the moment on the bill, let's take advantage of what we can do, which is start the waiver process.
I think we have time for about 2 more questions. Thank you for those asking and answering. I'm sorry, we have 4 hands up, but let's see how this goes. Bridget Boylan.
Thank you. Hi, hello, thank you. I'm finding this really informative and energizing. Thank you, everybody who spoke. I think this is a question for Eric Pierce as a Permanente representative or person or whatever. So I'm totally behind California single payer, ultimately the United States, but myself and many of my friends are happy Kaiser Permanente healthcare members. And so I'm kind of wondering, how would a system like California one single payer, how would that fold Kaiser Permanente into it, or would sort of start all over? And maybe that's too specific a question, but that's what I've been wondering about.
So I'm going to ask for some help on this, but your Kaiser system is not going away under this. It may change its name. It may have a different title. It may have a different organization, but your Kaiser system is not going away for sure. It's a great way to run care. And someone else help me out to answer this question, please.
I'll chime in a little bit, and I think it's exactly what Eric said. The problem is insurance, right? The problem is insurance, and insurance, rejecting risk, accepting risk. The Kaiser system, people really love or they really hate. There's not too much in between. It is very black and white. And so under single payer, we perceive, or we see the Kaiser delivery system staying in place. We don't see the Kaiser insurance system staying in place. And I think that's where the significant change is.
All right. Next, we have Michelle Krug.
Hi, I really appreciate the way this rally is giving people feedback as well as inspiration. I appreciate the lifting up of the financing. I think that that's critical. until that financing is acceptable. We're not even getting legislators to sign on to it. And I also am glad that people brought up the workers' comp. Here in San Diego, we've been putting some emphasis on getting local resolutions passed in support, both of single payer and of AB 1400. Do you think that this ultimately does help by bringing it to things, bodies like Board of Supervisors and school boards that obviously don't have a vote? But is this, do you see this as a, that we would be better use of our energy elsewhere? Or do you think that this is helpful?
I'm happy to take a crack at this. I think, and I'm going to let Pilar chime in as well, but I just want to say any opportunity to educate and to help others understand how single payer system works is well worth the while. And I know, Pilar, did you want to chime in as well?
Sure. Yeah, I totally agree. I mean, I think this is all about building a movement. And hello, everyone. I'm Pilar Schiavo. I'm the new Healthy California Now organizer. I'm super excited about being back in the single payer movement organizing. I think that we see that we really have to build a movement, and like Dolores Huerta was speaking about, that it's the voters who elect people and it's the voters who take people out. And so the more that we can do education with voters and really build the movement to build the kind of pressure that we need to hold our elected leaders accountable, the stronger that we will be and the further we can get this to the end game, to the victory, right? That we all have been fighting for, and some folks, on this call have been fighting for decades, right? It's enough already. It's time to make it happen. And if the pandemic hasn't shown us that we need a robust public healthcare system and something that ensures that no one will go bankrupt when they need healthcare, this pandemic has really, really put a spotlight on that issue. So that's a perfect segue, and exactly why we need to show up tomorrow to the Capitol. We're asking for folks to join us at a rally at the Capitol, 11 a.m. tomorrow. If you are in the Sacramento area or can drive there within a reasonable amount of time, please join us tomorrow at 11. We have phenomenal speakers who are going to be, sharing stories and talking more about the issues that we've talked about tonight. We have incredible labor leaders, Anand Singh from Unite Here Local 2 and Sal Roselli from NUHW. Dr. Paul Song, the president of California PNHP, will be there speaking. Diana Madashi, who is a retired registered nurse from the California Alliance of Retired Americans, and is also a senior human rights advocate. And I'll be speaking, and Cindy's going to be on scene. It's going to be a great event. But most importantly, we will be delivering the many thousands, over 19,000 petitions that people have signed throughout the state, calling on the governor to lead on this, calling on him to make this waiver happen. I know that there's so much frustration shared amongst, myself, many others, at Healthcare Now, that the bill has been put on hold for right now. And this is an opportunity for us to really continue the organizing and continue to move the issue forward until that can come back for a hearing, hopefully. So we, we're really looking for folks to join us. We also have a car caravan tomorrow at 10:30. And if you cannot join us, we still need you to lift your voice and make sure that Governor Newsom hears us. And so we're asking people to call in, call the governor tomorrow, let him know that we need him to lead, that we have his back, but he has to keep his promise. And we have all of the information for you to call. We have a script, we have the phone number, we have the RSVPs for the in-person rally or for the car caravan, all at Healthy California or healthyca.org. If you go to the Get Involved page, it's the first thing there. So please go to healthyca.org, click on Get Involved. You can see everything you need is going to be right there. If the script may go up in the morning, so just check back in tomorrow. You'll have the script to call the governor's office and the phone number to do it. And then get on Twitter with us. There's a social media toolkit right there as well. Let him know, tag the governor, hashtag Gavin Lead the Way, and join us to make sure that tomorrow our message is loud and clear that we need him to step up. We need him to lead on this issue. We know he campaigned on it. We know, I was in San Francisco when he signed the bill, Healthy San Francisco, and he has, campaigned on that success of guaranteeing healthcare in San Francisco all over the state. We know that this can work, and we know that he can really make California the first state to actually enact a single payer system and a Medicare for all like system. So thank you everyone for joining us today. This was incredible. I have a
question from Dolores Huerta. Maybe we should answer.
I just wanted to add kind of more proof. As I mentioned when I spoke earlier, I have several friends that are accountants in the healthcare system. One of them is like a CFO, and she told me that it just pains her every time that they have to write checks to the insurance companies because they don't do anything. And the money that is going to them could be going to other people to help them with their health care. And so these are some of the wrongs that have to be made right. And again, I just want to thank everybody. I think we can make this happen. We just have to make sure we get more people to communicate with the governor. And so we can say, we can make it happen. Sí se puede. Okay, the time is now. Medicare for all, single payer. Thank you.
Thank you so much. And again, thank you to all of our speakers who were phenomenal and just, make such an impassioned argument for this. If you want the governor's number, you can call 916-445-2841. That's what, wait until tomorrow. We're all going to call so he can hear us all loud and clear tomorrow, but it's 916-445. There you go. Jenny, hold it up when we're talking.
Well, this is not a phone number, but I can do that.
Oh, 445-2841. So 916-445-2841. And you can follow the prompts. But we really need everyone from all over the state to call in, make sure that he hears the message. And you can also watch the live stream, which we'll have on our Healthy California Now Facebook page. So if you can't be there, join us on Facebook, watch what's going on. You'll see the car caravan, you'll see the speakers. It's going to be a really powerful day, and we look forward to having you with us. Thank you. And thank you to Brandon for your incredible emceeing.
Thank you, Brandon. Thank you, everyone.
Thank all the organizers who put this together. Thank everybody who came to this call. Unity is how we win. Collective action is what we need. We are building a movement, and it is a movement that has been building for a very long time. In some ways, though, it's just the beginning. Yeah? We're almost there. Thanks, everybody, for coming out.
Before this, did you really know what live was? Comprehend to the track.